Hi, Dr. Kelly Starrett on behalf of H-Wave. One of the things that we're always trying to do whenever we have an acute onset of pain or dysfunction, or even some chronic persistent pain, is try to introduce as many low-level, non-threatening movements to the body as we can. One of the ways that we have to untangle this really complex psycho-emotional issue around pain and persistent pain, or even acute injury, is how can I begin to load tissues and, more importantly, tell my brain that it's okay to move again. Because my brain has perceived, for whatever reason, something in my body as problematic, and I'm interpreting that result, and I may have real fear, or I may have debilitating pain, or I may have just sort of shut down inhibition. It means my body is trying to protect itself or splint itself. And one of the ways that we use H-Wave technology especially around sort of low back pain, or even small movements of the back, or tweaks, or even chronic persistent pain around the back, is that we love that we can introduce what we call movement without motion. So what's nice here is that we have Margaret laying in a position of comfort where we have the pads on her back, and she's not even weight-bearing in gravity. So we've unloaded the tissues around the spine. And this is a very, very common position. Either she was on her back and hook lying, or maybe she's laying on her stomach, for example, so you can see. But in this position, we're not necessarily loading the tissues in a way that the brain is feeling or has been interpreting that we're having chronic pain or persistent pain. Most of us who have experienced pain around the back, what we see is that when we get out of a position which is loaded in gravity, where our brain thinks that we have a problem, sometimes going from unloaded back to loaded again can be a scary proposition, especially as the brain interprets very low muscle activity, low tissue loading, to suddenly, hey, we're loading, we're going to have to move. So one of the amazing things about using H-Wave, and in this case I've got the low frequency modulation going, is that I'm able to put the pads on, and we're now getting contraction in the musculature. And when we tend to think about muscle contraction, we sometimes fail to think about some of the other aspects of the tissue system. When the musculature contracts in the low back, for example, it's going to pull on a lot of the connective tissue of the back. The whole spine is a really remarkable system of tension, of musculature, of connective tissue, all working together in what we call a contractile field. So there's no one aspect of the system that's more important than the other. Musculature is important, your vertebrae are important, the actual backbones, but just as important is the connective tissue system and all of the other inputs from things like the lats, from the glutes, from the musculature of the trunk. It's all important in creating a stable, robust, and dynamic system. But when you have back pain, what we're interested in is, I need this pain to stop, I need relief. So oftentimes when we get out of these load-bearing positions where our brain is perceiving this as threat, we're now laying on our backs or laying on our stomachs, and what we're not doing is putting inputs back through the body to the brain to say, this is okay, it's okay for these tissues to move. In fact, we're going to have to move again. Then we get in a cycle where, because we're not loading the tissues, we're not moving the tissues, the brain starts to think, hey, a vacuum there is a problem. So when we stand up and load again, it can be a shock. One of the amazing things about this technology is you can see that as Margaret's been laying here and pumping, every time the muscle contracts, not only is she bringing blood flow and nutrients, are we breaking sort of the tonic lockdown spine, but all of this movement is telling her brain that, hey, I can move safely, and when these muscles contract, there's going to be nothing to think about or to be fearful of. The other thing that sometimes we fail to appreciate is that all of this musculature, paraspinal musculature, is directly attached to the spine. So when we're moving or using H-Wave on either side of the spine or across the spine, and we're getting any motion, every one of those things is actually, contraction is actually subtly moving the vertebrae themselves. So it's not just musculature. I'm getting motions of extension, a little bit of contraction and relax. And so I get really high frequency in terms of lots and lots of reps of non-threatening micro movements to the body. Again, because I'm not actually moving, I'm just starting to turn on and load the tissues in a way that's going to help them heal. Why? Because we're getting the garbage out, bringing the groceries back in, we're getting blood flow and hydration, but more importantly, I think, is that we're telling the brain that these tissues are going to be moving and are going to be loaded. And so it ends up being an analog to actual movement. So one of the reasons that we're trying to do this is, of course, to give ourselves immediate relief, but more importantly is to prepare the body for being back up in gravity so that we can occupy our roles in society. We can have our roles in the family, we can have our roles on our job, we can do our business of being human beings. And unfortunately, that's all about movement. So when we look at interventions, we're always asking, does this intervention block pain so that I can move again? Does this intervention restore and load tissue so that I can move again? Does this intervention give my brain a chance to think differently about what's happening at the body level? So again, when you're using H-Wave and this technology, understand that it's really as powerful as it is for on-demand pain relief. We're also preparing the body for moving and loading, and that's what the body does best.